Starting today, the NHS has quietly changed the rules on prescriptions, and millions of people in the UK have no idea. That includes how you get your medication, what you pay for it, and whether your regular prescriptions even still qualify the same way they did yesterday. We're talking about 5 significant changes that affect patients, carers, and families across England, from exemption categories to repeat prescription processes, online ordering rules, and even which conditions now qualify for free medication. And here's the thing. Most people won't find out until they're already at the pharmacy, standing at the counter, confused and caught off guard. Whether you're on long-term medication, picking up prescriptions for a family member, or you're a carer managing someone else's health, these changes affect you directly. Some people could save money. Others might accidentally end up paying a charge they didn't expect. In the next few minutes, I'm going to break down all 5 rule changes in plain English, tell you exactly what's different, and explain what you need to do or avoid doing starting right now. If you or someone you know relies on NHS prescriptions, smash that like button right now. It helps us reach the people who genuinely need this information before they get caught out. So let's get straight into it. As of today, the NHS has rolled out 5 changes to how prescriptions work in England, and the impact is going to be felt by tens of millions of people, many of whom still haven't heard a single word about it. Change number 1 is about prescription exemption eligibility. For years, certain groups of people have been automatically exempt from paying the standard prescription charge. That's currently £9.90 per item. But starting today, the criteria for some of those exemption categories have been reviewed and tightened. If you've been claiming free prescriptions based on a medical exemption certificate, particularly for certain long-term conditions, you need to double-check whether your condition is still listed under the updated qualifying criteria. The NHS has removed a small number of conditions from the automatic exemption list, meaning some patients who were getting their medication for free will now be expected to pay. It sounds harsh, and for a lot of people, it genuinely is. If you're unsure, the best thing you can do right now is log into your NHS account online or speak directly to your GP practice before you next visit a pharmacy. Change number 2 affects how repeat prescriptions are ordered and processed. This one is huge, and it's the change that's going to catch the most people off guard. The NHS is now moving to a more standardized digital-first repeat prescription system, which means many patients who were previously getting paper prescriptions handed to them by their GP will now need to use the NHS app or an approved online pharmacy platform to request and manage their repeat medication. For a lot of people, especially older patients and those without reliable internet access, this shift creates a real barrier. If you or someone you care for has been relying on a paper-based system, you need to act now to make sure there's no gap in your medication supply. Register on the NHS app, speak to your pharmacy about switching to an electronic prescription service, and do not wait until your next prescription runs out to sort this. Change number 3 is about online pharmacy authorization. Not all online pharmacies are equal, and the NHS is cracking down on which platforms are authorized to dispense NHS prescriptions under the electronic prescription service. Starting today, a number of smaller online pharmacy providers have had their NHS authorization revoked or placed under review, meaning that if you've been using one of these platforms to get your prescriptions delivered to your door, your next order might simply not go through. You won't always get a warning. You might just receive an error or worse, a long delay while the platform tries to resolve its authorization status. Check that the online pharmacy you use is still listed as an approved NHS dispensing contractor. You can verify this on the NHS website using their pharmacy checker tool. Change number 4 relates to prescription prepayment certificates, also known as PPCs. If you pay for multiple prescriptions each month, a PPC is one of the smartest ways to cap your costs, and the NHS has updated both the price and the application process starting today. The annual PPC rate has increased slightly, but here's the part that most people miss. The threshold at which a PPC actually saves you money has also shifted, because the per-item charge has gone up. If you're currently on 2 or more prescribed items per month, run the numbers again. In many cases, a PPC will still save you hundreds of pounds over the course of a year compared to paying per item. You can apply online through the NHS Business Services Authority website, and the certificate kicks in immediately. So even if you're picking up a prescription today, it's worth pausing to calculate whether buying a PPC first would save you money right now. Change number 5 is about medical cannabis and certain controlled drug prescriptions. This one is more niche, but it affects a growing number of patients in the UK. The NHS has updated its guidance on how certain controlled medications, including some prescribed for pain management, neurological conditions, and in a limited number of cases, medical cannabis, are issued and dispensed under NHS prescriptions. Some of these changes are about tightening the process to reduce misuse. Others are about expanding access in specific clinical pathways. If you or someone you know is on a controlled medication, your prescribing clinician should have already been in contact. But if they haven't, it's worth raising it at your next appointment. Don't assume the system will automatically flag it for you, because in a healthcare service under this much pressure, things can and do slip through the cracks. Now let's zoom out for a second, because there's a bigger picture here that's worth talking about. These 5 changes didn't happen in isolation. They're part of an ongoing effort by NHS England to modernize the prescription system, reduce administrative pressure on GP practices, and, let's be honest, manage costs. The NHS is under extraordinary financial strain right now, and some of these decisions are clearly designed with budget management in mind as much as patient benefit. That doesn't mean they're all bad changes. The shift to digital prescriptions, when it works well, genuinely does make life easier. But when systems are updated quickly and communication is poor, patients are the ones who suffer the consequences. You miss a dose. You pay a charge you didn't budget for. You end up on hold with your GP for 45 minutes trying to understand why your prescription didn't go through. These aren't small inconveniences. For people managing chronic conditions, they can be genuinely distressing. So what should you actually do after watching this video? First, check your exemption status today. Don't assume it hasn't changed. Second, if you're on repeat prescriptions, make sure you're set up on the NHS app and connected to an approved pharmacy through the electronic prescription service. Third, verify that your online pharmacy, if you use one, is still authorized. Fourth, if you pay for multiple prescriptions each month, calculate whether a prepayment certificate now makes financial sense for you. And fifth, if you're on any kind of controlled medication, have a conversation with your prescriber at your earliest opportunity. The reality is that the NHS prescription system touches the lives of nearly every family in this country, whether it's a child's asthma inhaler, a parent's blood pressure medication, or your own mental health prescription. These aren't optional items. They're not something you can just delay or skip. So when the rules change, people deserve to know about it clearly, in plain language, without having to wade through government websites or wait on hold. That's exactly why we make videos like this one. Share this with someone who needs to hear it. And if you found this helpful, you know what to do. Hit that like button. It genuinely helps more people find this kind of content when they need it most.